Clinical Sexual Disorders. Video created by Dr. O, Psychoeducation. Today, the Diagnostic and Statistical Manual of Mental Disorders, DSM-E, 5th edition, text revision, DSM-5-TR, classifies sexual disorders into three main categories: sexual dysfunctions, paraphilic disorders, and gender dysphoria. Sexual dysfunctions. These disorders involve a clinically significant disturbance in a person's ability to respond sexually or to experience sexual pleasure. The DSM-5-TR includes the following sexual dysfunctions: female sexual interest or arousal disorder, lack of or significantly reduced sexual interest and/or arousal, female orgasmic disorder, difficulty, delay in, or absence of orgasm, genitopelvic pain, penetration disorder, persistent or recurrent difficulties with vaginal penetration, often associated with pain or fear, male hypoactive sexual desire disorder, persistently or recurrently deficient, sexual erotic thoughts or fantasies and desire for sexual activity, erectile disorder, difficulty obtaining or maintaining an erection sufficient for sexual activity, premature, early ejaculation, ejaculation occurring within approximately 1 minute of vaginal penetration and before the individual wishes it, delayed ejaculation, marked delay in, infrequency of, or absence of ejaculation, substance, medication, induced sexual dysfunction, significant disturbance in sexual functioning that is judged to be due to the direct effects of a substance or medication. Other specified sexual dysfunction. Unspecified sexual dysfunction. For a diagnosis of sexual dysfunction, the symptoms must be persistent or recurrent and cause clinically significant distress in the individual. Paraphilic disorders. Paraphilic disorders are characterized by recurrent and intense sexual arousal to atypical objects, situations, fantasies, urges, or behaviors that cause distress or impairment to the individual or involve non-consenting persons. The DSM-5-TR lists the following paraphilic disorders: voyeuristic disorder, sexual arousal from observing an unsuspecting person who is naked in the process of disrobing or engaging in sexual activity. Exhibitionistic disorder, sexual arousal from the exposure of one's genitals to an unsuspecting person. Frotteuristic disorder, sexual arousal from touching or rubbing against a non-consenting person. Sexual masochism disorder, sexual arousal from the act of being humiliated, beaten, bound, or otherwise made to suffer. Sexual sadism disorder, sexual arousal from the physical or psychological suffering of another person. Pedophilic disorder, sexual arousal and urges involving prepubescent children. Fetishistic disorder, sexual arousal from the use of non-living objects or a highly specific focus on non-genital body parts. Transvestic disorder, sexual arousal from cross-dressing. For a paraphilia to be considered a paraphilic disorder, the individual must experience distress or impairment related to their paraphilia, or their paraphilia must involve non-consenting individuals. Gender dysphoria. Gender dysphoria refers to distress that may accompany the incongruence between one's experienced or expressed gender and one's assigned gender at birth. While related to sexuality in terms of identity, it is a distinct category in the DSM-5-TR. It's important to remember that the DSM-5-TR is a diagnostic tool used by mental health professionals, and these are complex conditions that require careful evaluation for accurate diagnosis and appropriate treatment. Thank you. Source: Gemini AI.